What is the role of medication in arthritis? The role of medication in arthritis is twofold. One is to prevent the progression of the disease. The other one is to treat the symptoms of the disease, which is pain, stiffness, and swelling of the knee. So, the first category of medication, which is to prevent the progress of the disease, there are several types of medication in that. Some of the common ones are glucosamine, chondroitin sulfate, diazepine. All these are supposed to increase the collagen glycosaminoglycan synthesis within the cartilage, which makes the cartilage quality better, so that further progression becomes slower. The second category in this is another very popular and common and more effective medication is called collagen peptides. These are newer class of nutraceuticals or nutritional supplements, which provide the basic building blocks which are required for collagen synthesis. You may be aware collagen constitutes 98% of the material in the cartilage, apart from water, which is the major component. So, when we increase the synthesis of collagen, it will imbibe more water, so it will obviously become more stronger, and so the further wear and tear will be reduced. The third category of medication is injectable medications, which again has various elements which will stimulate the cartilage to synthesize more collagen, to synthesize more glycosaminoglycans, and also will lubricate the joint more, so the cartilage quality will become better and the friction will become less. All these will also have some effect on the symptoms of the disease, which is basically pain and stiffness. So, this is the first category. The second category of medication is for symptomatic treatment, which are essentially either simple analgesics or painkillers, or anti-inflammatory medication, which are both painkillers as well as reduce the inflammation, which means swelling, redness, and stiffness around the joints. So, you have several classes of drugs in that. Paracetamol is one of the safest and probably the first, and probably also the mildest. Then we have some drugs which are opioid derivatives like tramadol. These have good pain relief, but may not be as strong anti-inflammatory agents. Then we have medication such as non-steroidal anti-inflammatory drugs, which are, you would have heard of ibuprofen, diclofenac, naproxen, ketorolac. All these medication will reduce the pain, swelling, stiffness around the joints, so that there is a good symptomatic pain relief, while none of these will actually regenerate the cartilage that is lost. These will give good relief and can also stop the progression, not completely stop, but slow down the progression of the disease. Landmark Hospital, India's best orthopedic and joint replacement center.